I think that residents and fellows who are applying should consider Cornell, because I think when you come here, not only do you get great training and exposure to so many wide variety of cases, you also get the support and the friendships and the feeling of family that Cornell provides. You get that sense that these people really have your back and they really want you to succeed in your future. They're always going to be looking for ways that they can increase your opportunities. And I think that that really distinguishes Cornell.
The reason why this is a good place for trainees to come here is, in my view, the forward-looking ideas that this department has. The expansion into computational pathology, the expansion of molecular pathology and clinical genomics, the utilization and learning how to utilize big data. We're at a pivotal point, we're at a transformation point in pathology. And I think the trainees and fellows that come here will experience that.
Residents and fellows that are thinking of coming to Weill Cornell Medicine should feel confident that this is the ideal place for them to begin their career. And the reason for that is because we stress so much the training of our residents. So the faculty from day one of any resident's career, any fellow's career as they start out here, is to make sure that the residents are getting excellent clinical education, but that they're also developing their CVs, that they're participating in non-clinical activities that will help them to actually gain traction in academics or wherever they may want to ultimately have a job. And that's evident with our mentoring process, that's evident with the fact that we encourage residents to become involved in research projects, to actually present their research at national meetings. And so they're getting all of this experience in doing research and presenting information and developing networks with other people within pathology. And so our residents do very well, our fellows do very well. They're able to secure highly competitive positions coming out of the program.
At the end of the day, when you put aside all of our individual or departmental goals, ambitions, motivations, we're all here for the same reason. And that reason is patient care, simply patient care. There's no question that our hospital is able to provide the best patient care anywhere. And we're fortunate enough to work with some of experts in the field that do that better than anybody.
I think when I was looking at other institutions, the molecular presence here in this department is very strong. Again, like the number of faculty, the number of assays that we offer, and really the push to innovate in terms of the assays that we are offering. There's a lot of support from leadership for that. So I found that very appealing. And also just being in New York City, this institution has a huge presence in this city. And it's important in terms of the types of cases you can see and the type of impact you can have in terms of how you're helping the general community.
I think that Weill Cornell Pathology is one of the best, if not the best, place for residents and fellows to begin their career. Our department really dedicates itself to training and education, especially being associated with Weill Cornell Medicine, one of the top medical schools in the country. The faculty are truly devoted to raising the next generation of pathologists, and the research support that the department provides allows these residents to get exposed early on in their careers to what's always going to be a lifelong career of learning in medicine.
What you have here is a number of factors which are beneficial to sort of beginning your training. I think, first of all, although you work very hard here, you never feel like you don't have somewhere you can turn to or someone that can support you when times get very difficult, which they inevitably do at times. The fact that you have high volume and many different surgeons, you'll see a lot of different specimens, which is helpful in training. The fact that everyone's so sort of collegial and professional, and you also form strong friendships with other residents. I think all of these are important factors. My favorite part of living in New York City really has to be the food. I wasn't a foodie before I came, but since I've gotten here, I think it's hard to ignore the cuisine.
Living in New York City is an amazing experience. I mean, I grew up in a city without public transportation, so being able to just hop on the subway, hop on the bus, and go anywhere in the city is such an amazing feeling. There's so many opportunities for entertainment, for food, for views, and just walking around the city. I love it. I love living here.
It's an excellent area if you're interested in trying to be on the cutting edge of something and pioneering something new. There's new technologies, there's new molecular techniques, there's so much kind of rapidly changing in pathology where I think it's an exciting area to be in.